Hi, my name is Seeto. I'm one of the Master Instructor trainers from Merrithew. I'm also one of the clinical instructors for the STOTT PILATES Rehab program. Joining me here today is Seeto. He's our instructor trainer from Brazil. And he's helping me with the Multifidus targeter exercise. So it's one of the exercises that we teach in the Rehab Mat 1 module, which is the focus on spine, scapula, and pelvis stabilization. Okay, so in this position here, he's in that quadruped position, so gravity is going to influence the spine. What's going to happen here is that we've got a ball underneath his lumbar pelvic region, which is going to provide you with some low load resistance. Okay, so here you want his upper torso to be neutral. So again, you can see he's got a little bit of flatness through his thoracic spine. So an easy way to correct that is to get him to just lift up through the sternum a little bit. So just pull up through here more. Okay, drop, 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 push down and lift up, push away from my fingers. There, perfect, much better. Good. So I often find that just using a correction at the sternum has a better connection into the thoracic and the ribs, so you get a little bit of better control through the region. If you had some issues with the scapula, then I'd be kind of cueing through the hands a little bit. Okay. So here what you want to do is that you want to identify the iliac crests. You bring your hand across to just give a volumetric hold over the sacrum. Okay. What we're going to do is that we're going to globally get him to associate the pelvis with the lumbar spine, and we're going to get a gentle resistance to try, a low load resistance to try to get the multifidus and the deep paraspinals to fire up a little bit. Okay, so what's going to happen here is I usually have to take my hand along the ASIS. It gives me a little bit more control through the patient. Okay, so we're just going to breathe in, and then on the breath out, with the therapist, my body weight, I'm just going to lean forward to give him a sense of the kinesthetic motion I want. And you can see here already we've got that fullness through the paraspinals because of that low load resistance coming from the stability ball underneath his abdominal and pelvic area. Okay, we can get him to hold it there for a little bit. And then we can come back and he can use the ball to have the release. So he doesn't have to actively tuck the pelvis. So think of this as almost like a resisted return to neutral and a facilitated flexion of the pelvis. Okay, so again, we're just going to get him to, we rock forward. Okay, one way to identify the neutral pelvis is you want that sacrum to be kind of parallel to the floor. So imagery is quite helpful in Pilates. So things like balancing a cup of tea filled to the brim on the pelvis does work quite well with a lot of your patients. Okay. Now what you may find here is that because it's such a global motion, they can have a little bit of overflow into the rectus spinae. Okay, so this is where you may wish to take more of a segmental approach to that rebuilding of the neutral. So the way that you can do that is, again, you want to palpate the spinous processes. So you just want to find your iliac crest. You kind of come across and you'll identify the L4 or the L4-5 inner space. We're going to drop and we're going to find that vertebra. Okay, so then from here what we're going to do is that we're going to do a gentle anterior pressure through that spinous process. Okay, and you want that the patient to feel like they're pushing my finger forward into the ball. And you can see we have just a gentle motion and we stop. As soon as we feel a response in the superior spinous process, we ask them to stop. And then we walk up to the next spinous process. Same thing. Okay, so you want to give him that volumetric pressure into the spinous process where he's pushing your finger down like a piano key into the ball. We stop. Okay, when you start to feel the response more superiorly, okay, we go to the next vertebra. Okay, and this one especially, we're going to go forward, stop. So you can see how he dropped through the rib cage here. If you see that, what you can do is you can bring your hand underneath the rib to give him a bit of that block. Okay, let's go to the next one, and we're going to fall into the ball, down, down, down. That's it, perfect. Okay, and we're just going to go one more vertebra and go forward. Okay, we hold that position. Okay, and you can see that it's because it's a little bit more segmental in nature, the incremental movement can be a little bit lower. You often actually find increased tone through the paraspinals, but if you were to palpate through that QL region, the tension is quite less. Okay, so you're a little bit more focused through the multifidi muscles here. Okay, what you can do after this is, because the ball is there for feedback, you can build the endurance, and then we can progress them by getting them to do dissociative tasks with the arm and leg. So I could ask him to bring his right arm up, okay, and you can see that's a little bit of too much weight shift, come back. Okay, so you'd have seen in the video, he kind of dropped through here. So let's rebuild. Okay, so dropping down just to there. Okay, coming back. Good, perfect. Perfect. Okay, so we get the paraspinals involved, but we want rotational control. So he's going to have to work a little bit more through the obliques through here. So he's going to lift up through here. Good, and then he's going to float that right arm. Much better. Okay, so you didn't see that sudden drop into the ball. Okay, and coming back down. Okay, so that's your multifidus targeter, often an area that can be a little bit stubborn when you have someone who has recurrent back pain or mechanical low back pain. Adding that proprioceptive input and that low load resistance can be quite helpful. Okay, hope you enjoyed that, and I'll see you again.